As expected, the Biden administration has repealed the Mexico City policy. The move frees up U.S. funding for agencies overseas that assist in family planning, including providing birth control and abortions. Former President Trump put the policy into effect in 2017, cutting off funding for several international programs, including the United Nations Population Fund. We want to bring in Dr. Natalia Kanem. She is the executive director of the United Nations Population Fund. Dr. Kanem, welcome. It's great to have you with us. Can you tell us exactly what the UN Population Fund does? Who does it help?
UNFPA is the United Nations Sexual and Reproductive Health Agency. And every year we help millions of vulnerable women and girls. I'm talking about a woman who right now under COVID may be in an abusive situation with the lockdowns. We're there to help governments and NGOs staff hotlines. It might be an expectant mom who needs prenatal care. How is she going to get to the clinic? And will there be a midwife when she gets there? UNFPA trains midwives and makes sure that even in a humanitarian setting, even in the rubble of conflict, we're there to handhold that situation and give professional care, counseling, social work for women and girls.
And what does this additional funding from the U.S. mean for the program? What was lost when the Trump administration cut that funding?
Losing U.S. funding meant that we had to curtail certain life-saving activities that we were providing. For example, to be able to give adolescents the ability to understand their bodies, to make sure that women who want family planning are able to access this. And similarly for death in childbirth, the U.S. funding is very, very important in humanitarian and in peacetime situations. More than that, the funding and the moral strength of the United States in defending the rights of women and girls is something that drives a lot of the equation in these 150-odd locations around the world where UNFPA works. So we are quite expectant that the USA will be speaking for the rights of women and girls.
And there are, of course, some critics saying that this means the United States would be directly paying for abortions in other countries. What is your response to that?
The laws regarding abortion vary from nation to nation. As UNFPA, and we work very closely with governments around the world, we adhere to law and policy. It's understood that part of the contributing factor to death during pregnancy can sometimes be from unsafe abortion. And our position is that no woman should die at the hands of a situation where she's had an unsafe abortion and could bleed to death. We're not a provider of abortion care, but we also understand the realities that so many women in desperate situations around the world face. And in adhering to law and policy to the letter, as we do, we also advocate that where abortion is safe, is legal, it should be safe.
And Doctor, the president's repeal of the so-called Mexico City policy is expected. It has been invoked by other Republican presidents and repealed by Democratic presidents. Does this force what is supposed to be essentially a nonpartisan agency to get involved with politics?
Politics are a reality, and our position in UNFPA is that politics should assist women and girls in vulnerable situations to be able to traverse adolescence, womanhood, pregnancy safely. We regret that sometimes, because of domestic policies in USA and sometimes in other countries, there's misinterpretation of what it means to have someone who is ready to help you when you are in labor and could potentially die during childbirth. The issues that have to do with politicization of sexual and reproductive health mean that women's rights become negotiable. And women inherently have equal rights. And UNFPA is there through thick and thin to defend the rights of that woman and that girl so that she can access life-saving care, including family planning, which is one of the big things that we do all around the world.
Dr. Natalia Kanem, thank you so much for all the work you do protecting vulnerable girls and women around the world, and thank you for joining us.
Thank you so much, John.